Welcome back to Senior Healthty Care, where you will discover several recommendations for seniors. Today, we provide essential suggestions for seniors that cannot be overlooked over 60. The only lunge you need for strength, balance, and mobility. As persons age, the ability to move independently becomes more vital. Rising from a chair, transporting groceries, and climbing stairs need lower body strength, balance, and mobility. Targeted physical activity may mitigate or reverse the decline in muscle mass and stability beyond the age of 50. Lunges are among the most efficient and attainable exercises. This singular workout enhances the physical abilities necessary for autonomy and daily participation when executed correctly. Lunges are intricate, useful motions that engage several muscle groups and joints resembling routine tasks. The advantages are its adaptability and simplicity. It requires no specialized equipment, can be tailored to any fitness level, and offers practical benefits rather than aesthetic ones. The lunge enhances functional performance, mitigates injury risk, and elevates quality of life by simulating daily mechanical requirements, such as single-leg loading, hip and knee flexion, and extension, and postural stability. This presentation outlines the physiological and practical advantages of including lunges into the normal exercise regimen for those aged 50. It analyzes the effects of exercise on mitigating age-related muscle atrophy, enhancing neuromuscular coordination and balance, restoring joint flexibility, and augmenting metabolic health. It offers comprehensive guidance on correct technique, prevalent errors to circumvent, enhancements for safety and efficacy, and a pragmatic progression framework to assist individuals in doing lunges safely. Resistance training and sarcopenia. Sarcopenia, the progressive decline of skeletal muscle mass and strength, is a significant physiological challenge associated with aging. Current opinion in rheumatology indicates that those over 50 may have an annual decline of 1 to 2% in muscle mass. The loss significantly impacts the lower body muscles responsible for movement stability and everyday activities. Sarcopenia induces frailty, increases the risk of falls, and leads to functional decline. Sarcopenia has several etiologies. They include hormonal abnormalities, lowered growth hormone and testosterone, persistent low-grade inflammation, decreased muscle cell anabolic signaling, and a loss in motor unit number and function, particularly power-generating fast-twitch fibers. Inactivity and insufficient protein consumption exacerbate these processes. This process is most effectively countered by resistance exercises such as the lunge, which stimulate muscle protein synthesis, activate high-threshold motor units when appropriately loaded, and improve neuromuscular efficiency. Strength training for older individuals aims to restore functional strength, sufficient power, and endurance to do daily tasks safely and with confidence, rather than maximizing lifting capacity. The lunge is optimal for this purpose, since its movement pattern mimics several everyday activities. Examine the correlation between certain lunge elements and conventional movements. The quadriceps, gluteal muscles, and hamstrings must collaborate to rise from a chair or sofa. These muscles are synchronized and effectively developed during lunging. Muscles adapt to control the body's descent during the eccentric contraction of the lunge, enhancing joint stability and mitigating abrupt loading. The ascending concentric phase generates force to lift the body against gravitational pull. Consistent lunging may reduce arm use and enhance sitting to standing transitions for those who rely on their hands for support when standing. Ascending stairs. One limb bears the body's weight, resulting in unilateral loading. This challenge recurs throughout the forward lunge. Descending stairs requires eccentric control to decelerate and lower the body safely, while climbing demands concentric engagement of the quadriceps and glutes. Lunge strength enhances the efficiency of stair negotiation, reduces exertion, and minimizes joint stress. Lifting objects. Asymmetrical loads, such as retrieving luggage from a vehicle or carrying a kid with one arm, impose demands on core stability and unilateral control. Unilateral lunges train the body to stabilize in an uneven manner. Engaging core muscles such as the abdominals and obliques inhibits torso twisting or tilting, so stabilizing the spine and enhancing stability while handling off-center loads. Bending and kneeling activities such as gardening, retrieving objects from the ground, and fastening shoelaces need synchronized flexion of the knees and hips. The lunge improves the functional range of motion of these joints and strengthens their supporting muscle groups, reducing perceived effort and the risk of strain or injury. A comprehensive understanding of muscular anatomy elucidates the efficacy of the lunge exercise. The motion engages many trunk and lower body muscles. Primary movers, the quadriceps of the anterior thigh and the gluteus maximus of the buttocks, provide force. Knee and hip extensions enable an individual to rise to a standing position. Synergists and stabilizers. The adductor magnus of the inner thigh and the hamstrings of the posterior thigh facilitate movement. The gluteus medius and minimus, smaller lateral hip muscles, stabilize the pelvis and avert knee valgus, a common cause of knee discomfort. Core engagement. The transverse abdominis obliques and erector spinae muscles maintain spinal alignment throughout the lunge. Core activation enhances equilibrium and facilitates force transfer between the lower and upper extremities. Minor stabilizers. The intrinsic muscles of the foot, together with the tibialis, anterior tibialis, posterior and peroneal muscles around the ankle, assist in modulating each step and landing. These underutilized muscles are essential for adapting to uneven terrain and preventing ankle sprains. When an elderly individual does several well-performed lunges every day, they prompt the body to preserve and enhance muscle in these crucial areas. The lunge transcends a mere gym workout. It combats sarcopenia and restores muscular confidence essential for independence. Neuromuscular retraining using lunges for fall prevention and balance enhancement. Falls are a significant health concern for the elderly, as per the United States. The Centers for Disease Control and Prevention say that millions of individuals aged 65 and older get treatment in emergency departments annually for injuries linked to falls. While aging may impair balance systems, a decline in stability is not unavoidable. Dynamic movements such as the lunge may enhance balance and reduce fall risk. The visual, vestibular, and somatosensory systems, including proprioception, govern balance. Muscle tendon and joint receptors provide the CNS with information for proprioception. Age may impede these signals and the brain's capacity to assimilate them, postponing balancing adjustments. Various complementary methods via which the lunge enhances proprioception and dynamic balance. Maintaining both feet together provides more stability than adopting a split stance with one foot positioned front and the other backward. This purposeful instability requires micro-adjustments in the feet, ankles, knees, hips, and trunk to sustain balance. Each repeat momentarily challenges the neuromuscular system, enhancing muscle and reflex coordination. The brain system acquires the ability to predict and react to shifts in the center of gravity via recurrent lunges. In reality, expedited and more synchronized neuromuscular reactions may prevent or mitigate falls caused by abrupt excursions or irregular curbs. Stability in the foot and ankle reinforces the integrity of the superior joints. Lunges enhance the strength and endurance of the peroneal and tibialis muscles. Enhanced stability on uneven surfaces minimizes ankle sprains and falls. Core stabilization. Balance relies on the muscular support of the trunk. A robust core stabilizes the pelvis and spine, enabling the limbs to function from a secure foundation. To sustain posture throughout the split stance, the lunge requires ongoing core engagement, enhancing postural control in activities such as walking, turning, reaching, and other daily movements. The dual task and perturbation potential of lunges may be enhanced by including cognitive tasks like counting backwards or upper body movements, such as lifting a light load, to more accurately reflect real-life multitasking challenges. Introducing modest controlled perturbations, such as a partner's gentle push or an unstable surface under supervision may effectively enhance reactive balance. Lunges may induce instability in novices, indicating a positive transformation in their balance mechanisms. Consistent practice diminishes tremors and enhances self-assurance. The psychological benefits of physical growth include a reduced fear of falling and increased exercise, hence enhancing health. Articular function, cartilage integrity, and locomotion. Mobility refers to the dynamic movement of a joint, whereas flexibility denotes the passive extensibility of muscles and connective tissues. Sedentary habits, particularly prolonged sitting, restrict hip mobility. Lunges enhance musculature and augment movement. Alleviate rigid hip flexors. The iliopsoas group extends from the lower spine and pelvis to the femur. Prolonged sitting leads to the shortening of these muscles, resulting in chronic stiffness and an anterior pelvic tilt. This postural change is associated with lower back discomfort, reduced stride length, and shuffling gait. The trailing leg actively and gently expands the hip flexors during the lunge. Muscular control enhances the safety and efficacy of stretching for the restoration of length and function over time. Activating underused glutes. When hip extensors, such as the gluteus maximus, do not engage correctly, a condition known as gluteal amnesia, other muscles are forced to compensate, increasing the likelihood of overuse injuries and inefficient movement. Lunges are effective for developing the gluteal muscles. Robust responsive gluteal muscles facilitate ambulation, ascension, and lifting, while providing stabilization to the pelvis and lumbar spine. Lunges provide controlled weight-bearing movement for the hip, knee, and ankle, enhancing joint health. Movement facilitates the circulation of synovial fluid, which lubricates and nourishes joint cartilage, so enhancing joint health. Appropriate intensity and technique in moderate continuous loading may reduce stiffness and maintain function in mild degenerative joint alterations without causing pain. Restoring functional ranges. Daily activities include hip, knee, and unilateral balancing exercises. The lunge integrates these requirements, ensuring that improved mobility is easily relevant to daily tasks instead of being a transient stretch. Enhanced mobility results in increased perceived comfort and flexibility of movement. Alighting from a car, stooping to tend to a garden, and bending to lift a grandchild become more manageable and less fatiguing. The resurgence of fluidity may enhance and expand an individual's endeavors. Metabolic consequences of lower body muscle preservation. Older individuals have reduced basal metabolic rates due to a reduction in muscle mass, which subsequently decreases metabolic activity. Sarcopenia lowers resting energy expenditure due to the higher energy consumption of muscle compared to fat. Activating the major lower body muscle groups during lunges enhances metabolic health in several ways. Developing lean muscle. The quadriceps, hamstrings, and gluteal muscles are robust. Consistent resistance exercise protects and develops lean muscle mass. An increased proportion of lean mass elevates the basal metabolic rate, facilitating more calorie expenditure at rest, aiding in weight management and enhancing body composition without the need for extreme diets. Enhancing insulin sensitivity. Cells respond to insulin to absorb glucose from the bloodstream. Sedentary aging increases insulin resistance, hence augmenting the risk of type 2 diabetes. Skeletal muscle may enhance glucose uptake independent of insulin during lung contractions. Consistent resistance training improves muscle insulin sensitivity, hence reducing blood glucose levels over time. Enhanced insulin sensitivity reduces fluctuations in glucose levels and alleviates metabolic stress caused by insulin resistance. Energy stability. Improved glucose regulation often enhances energy stability. Exercises targeting large muscular groups, such as lunges, assist individuals in sustaining energy levels throughout the day, preventing the postprandial energy spikes and declines that often signify inadequate glycemic control. This may assist in maintaining activity and averting fatigue. Lunges primarily serve as a resistance exercise. However, walking lunges provide a little cardiovascular benefit. This may enhance aerobic capacity when combined with other aerobic workouts, hence improving blood pressure, cholesterol levels, and cardiovascular health. In summary, daily lunges provide little exertion while delivering significant metabolic benefits. Rather than developing an athletic physique, they preserve muscle tissue for energy production and metabolic health. The advantages include enhanced vitality and active life engagement without experiencing low energy levels. Instruction secure and effective, lunging methodology. Technique and progressions are essential to optimize benefits and mitigate harm. This document outlines the procedures for executing lunges safely and effectively, highlighting common errors, practical enhancements, and progression strategies. Procedure for the fundamental bodyweight lunge. Begin with feet positioned at hip width, maintaining a neutral spine and engaged core. Gently retract the navel towards the spine. If you typically position your feet in front with a little turnout, proceed accordingly. In the first stages of learning, hands may be positioned on the hips clasped in front of the chest, or gently placed on a stable surface for support. Execute a measured step forward with one leg extending 2 to 3 feet based on leg length and comfort. The step distance should allow the front knee to align about above the ankle at the lowest point of the lunge, while the thigh of the rear leg should experience a comfortable stretch. Transition to complete contact with the ground after heel landing. Rather than projecting the chest forward, descend the body directly downward by allowing the hips to drop vertically. Flex both knees to an angle of 90 degrees. The front knee must be positioned above the ankle, not extending beyond the toes. With the exception of knee touch variations, the rear knee should remain elevated above the floor. Distribute weight between the heel and mid-foot of the front foot. Assume an upright posture with a neutral spine and direct your gaze forward. Maintain a posture with shoulders relaxed and positioned down and back. Envision a thread, pulling your head upward toward the ceiling to maintain spinal length. Ascending phase. Apply pressure via the heel of the front foot to rise and unite the feet, or return to the initial position for alternating lunges. Gently exhale while ascending. For symmetry, repeat the same number of repetitions on the other leg. A high repetition total is less significant than control and symmetry. Chronometry, rhythm, and exertion. Novices get advantages from a controlled tempo of 2 seconds, descending a 0-1 second pause at the nadir and 1 to 2 seconds ascending. Prolonged eccentric lowering phases enhance stress duration, fortifying muscles and joints. As you increase strength, you may use extended eccentric phases for enhanced control or rapid concentric phases for power. 2 to 3 sets of 5 to 10 repetitions per leg serve as an appropriate first benchmark for older individuals beginning a resistance training regimen. Upon establishing the technique, 12 to 20 repetitions may enhance muscular endurance and metabolic fitness. To develop strength and hypertrophy, do 6 to 12 high-quality repetitions with moderate resistance. Allow 60-90 seconds of rest between sets for strength and skill enhancement, and 30-60 seconds for endurance or metabolic-oriented circuits. Progressive overload. Enhance difficulty by augmenting repetitions, increasing load using handheld dumbbells, a weighted vest, or a complete backpack, extending range of motion, decreasing speed, minimizing support, or transitioning to more challenging activities. Progressive overload must be incremental, ranging from 1 to 3 weeks of slight increases based on recovery and adaptation. Illustrative technical faults and rectification prompts. Excessive forward tilting may exert tension on the anterior knee and lumbar region. Lower directly downward while maintaining an elevated chest position. Maintain the sternum in a superior position relative to the pelvis. If the front knee extends beyond the toes, the stride is severely abbreviated or the weight is shifted forward. Extend your stride and maintain your center of mass over your midfoot. Envision the heel pushing the floor away. Weakness in the hip abductors, especially the gluteus medius, may occur if the anterior knee exhibits valgus collapse. To ensure proper tracking, forcefully move the knee slightly outward and consider a modest external rotation of the hip. Side-lying clams, band walks, and lateral step-ups enhance the strength of the gluteus medius. A convex thoracic spine diminishes mechanical efficiency and may lead to lumbar strain. Unclench the chest, release the shoulders, and activate the core. Employ thoracic extension mobility if mobility restricts chest positioning. Excessive movement may alter loads and induce discomfort. Determine a stride length that permits both knees to flex to 90 degrees effortlessly. The posterior chain has less loading while propelling off the front toes. Concentrate on driving into the anterior heel and midfoot to activate the gluteal and hamstring muscles. Modifications and enhancements aid individuals with diverse talents. In Phase 1, beginners or those with balance issues establish a foundational skill set. Position yourself with one hand resting on a wall, sturdy chair, or countertop for stability while doing an aided lunge. This support enables you to focus on form without losing balance. Split squat static lunge, descend and ascend without stepping. The loading pattern is maintained while the requirements for dynamic balancing are reduced. Shallow lunge, initiate with a little drop and progressively deepen as control and comfort improve. Alternative step-up. Performing step-ups onto a low platform, 4 to 6 inches, may provide more stable single-leg loading for those with balance difficulties. A suitable starting point is 2 to 3 sets of 5 repetitions for each leg executed slowly and deliberately with a 60-second rest interval between sets. These little amounts enhance strength and coordination without fatigue. Phase 2. Mastery of bodyweight lunges. During descent, strive for the front thigh to be parallel to the floor. Exercise caution with alignment and control. Augment repetitions, preserve technique while escalating repetitions to 10 to 12 per leg in each set. Incorporate controlled eccentric movements 3 to 4 seconds descent, stability pauses 1 to 2 seconds, or delayed concentric completions to emphasize strength enhancements. Augmented complexity and operational diversity in Phase 3. Execute a reverse lunge by stepping backward. Reverse lunges restrict forward movement, making them more manageable for the anterior knee. They may be useful after foundational techniques are developed. Lateral lunge. Extend laterally with toes facing front, flex the stepping leg, and retract the hips while keeping the opposite leg straight. The adductors and abductors are fortified, enhancing lateral stability. Walking lunges, rather than reverting to the initial posture, advance with the rear foot to assume the role of the front foot for the subsequent lunge. This variation enhances functional transfer to walking and gait by including cardiovascular and dynamic balancing elements. Curtsy lunge. Extend the posterior leg backward and laterally to engage the gluteus medius and emphasize frontal plane stability. Bulgarian split squat. A unilateral squat with the posterior foot elevated on a bench or step. This improves front leg demand and range of motion regulation. The more intricate variation should only be attempted after establishing strength and balance. Loaded lunges employ small dumbbells at the sides, a kettlebell in a goblet position, or a weighted vest to effectively include resistance. Slow, eccentric, or negative-only exercises, including gradual lowering and assistance from the opposite foot for elevation, induce strength stimulation. For robust young seniors with optimal joint health-controlled plyometric variations, such as small hop lunges, may enhance power. Approach this with caution and discernment. Programmatic concerns and illustrations. For the majority of elderly individuals, doing 2 to 4 lunges weekly within a strength and mobility regimen suffices to effect significant improvements. The recovery period after rigorous lower body exercises should be 48 hours. Volume initiate with 6 to 12 sets of lunges per week, distributed among sessions. Commencing with 3 sessions of 2 sets per leg or 2 sessions of 3 sets per leg may be advantageous. A growth timeline of 8 to 12 weeks is acceptable. The first weeks focus on technique and confidence, The intermediate weeks enhance repetitions or range. The latter weeks include light loads or advanced variations. Accommodate for recovery pain and joint complications. Illustration of an 8-week introductory progression with bi-weekly sessions. Weeks 1-2. Concentrate on technique with aided static lunges, 2 sets of 5 repetitions for each leg. Weeks 3-4. Perform bodyweight forward lunges, 2 to 3 sets of 6 to 8 reps each leg at a controlled tempo. During weeks 5 to 6, do 3 sets of 8-10 repetitions per leg, including a short eccentric emphasis with a 3-second descending phase. Incorporate reverse or walking lunges weekly, doing 3 sets of 8-10 repetitions with light weights during weeks 7 to 8. Sample 12-week intermediate program with 3 weekly sessions. During weeks 1-4, do 3 sessions per week of bodyweight lunges, both forward and reverse, including 3 sets of 8 to 10 repetitions for each leg, and include mobility exercises after each session. Augment resistance with dumbbells or a weighted vest during weeks 5 to 8. Execute 3 sets of 6 to 10 repetitions for each leg, alternating between eccentric and rapid tempo days. Weeks 9 to 12. Enhance functional carryover with Bulgarian split squats, lateral lunges, single leg balance holds, and other carrying exercises. Warm-up 5 to 8 minutes, skill practice, 2 to 4 minutes of assisted lunges, primary sets, 2 to 4 lunges, auxiliary exercises, glute bridges, banded lateral steps, calf raises, balance drills, 30 to 60 seconds each, and cool down. Clinical considerations and contraindications. Exercise caution in certain clinical circumstances. Individuals should see a physician or physical therapist prior to engaging in lunging exercises. Individuals with advanced osteoarthritis, meniscal disease, and other significant knee pain conditions. Professionals may propose glute bridges, which engage hip extensors without requiring weight-bearing knee flexion or seated leg extensions. Patients undergoing hip and knee surgery must adhere to the rehabilitation protocols prescribed by their surgeon and physical therapist. Lunges must be introduced only with explicit authorization and guidance, and adjusted according to the healing stage. Individuals with significant balance difficulties, particularly those with vestibular dysfunction, should first engage in seated or heavily supported exercises to build strength and confidence prior to attempting unsupported standing lunges. Individuals with uncontrolled hypertension, unstable cardiovascular disease, or recent cardiac events should get medical clearance prior to commencing an aggressive exercise regimen. Allow acute joint inflammation, swelling, severe pain, and warmth to diminish, and see a physician prior to exertion. Individuals with peripheral neuropathy, diabetic foot complications, or substantial sensory deficits should engage in balance-intensive activities with caution and under medical supervision to enhance safety and functionality. Diverse exercises and supplementary movements. Lunges are robust and versatile. However, they are not the only instrument. When lunges are contraindicated or to enhance program balance, use complementary exercises. Hip extensors are engaged with little knee strain with the use of glute bridges and thrusts. Beneficial for activating the gluteal muscles before lunges. Seated or supported leg presses. Consistent incremental loading throughout first recovery. Step-ups provide single leg loading in a more controlled plane and are often more comfortable for certain knee conditions. Calf raises and ankle fortification enhance push-off power and ankle stability. The lunges balance regimen is enhanced by single leg stands, tandem walking, and dynamic step-downs. Enhancing hip mobility and soft tissue treatment, leg swings, hip openers, and quadriceps and gluteal foam rolling together with focused soft tissue therapy may enhance lunge performance and reduce discomfort. Assessment of progress. Consistent assessment sustains motivation and provides an objective measure of progress. Utilitarian clinic-compatible assessments measure the duration taken by an individual to rise from a chair, traverse 3 meters, execute a turn-return, and sit down. Enhancements indicate increased mobility and fall avoidance. 30-second chair stand. Record the number of complete stands the participant can do within 30 seconds. An elementary measure of lower extremity strength and stamina. Assess the duration for which an individual can maintain balance on one leg with eyes open until reaching an appropriate threshold, e.g., 30 seconds. A heightened equilibrium is seen. Duration required to ascend and descend a staircase. Changes signify enhancements in everyday functioning activities. Gait velocity. Assess comfortable ambulation speed over a distance of 4 meters. Marginal enhancements in gait velocity foster autonomy and reduce mortality risk. Subjective measures. Evaluate perceived ease of daily activities, car transfers, stair ascending, less need for hand assistance when rising fear of falling, and self-confidence. Footwear respiration warm-up and cool-down enhance safety and efficacy. Footwear. Utilize low-heeled supportive shoes that provide traction and arch support for enhanced stability. Refrain from using socks and slippers that compromise equilibrium. Barefoot lunges on non-slip surfaces may enhance foot strength, but only for those with robust balance and secure flooring. Exhale with exertion the ascending phase and inhale during descent. The pattern sustains intra-abdominal pressure and spinal stability. Refrain from breath holding, particularly in those with hypertension. Warm-up. Prior to lunges, engage in 2 to 5 minutes of light aerobic exercise such as marching in place, a gentle walk, or stationary cycling, followed by dynamic mobility exercises, including leg swings both front to back and side to side, ankle circles, hip circles, and hip openers like the world's greatest stretch. Heating increases tissue temperature, synovial fluid viscosity, and neuromuscular readiness. Recovery and flexibility exercises. Following lunges, delicately stretch the hip flexors, hamstrings, and calves, and use a foam roller or massage to alleviate discomfort in affected regions. Conclude with diaphragmatic breathing to facilitate heart rate lowering and recovery. Environment. Utilize a flat, unblemished surface and enough illumination. Exercise caution with irregular ground conditions when engaged in outdoor activities. Commence lunge next to a stable chair or countertop initially. Remediating and alleviating pain, delayed onset muscle soreness. DOMS often occurs after the initiation or escalation of lunges and typically resolves within a few days. Progress is hindered when pain obstructs daily tasks. Acute localized joint pain during a lunge necessitates cessation and reevaluation of technique. Consult clinicians if pain persists. In the event of knee pain, consider doing reverse lunges, reducing the range of motion, decreasing the load, or focusing on eccentric control with a more shallow descent. Robust glutes and hip abductors enhance alignment and mitigate knee discomfort. For hip pain, start a warm-up, evaluate for excessive lumbar or pelvic motion, and reduce stride length if impingement arises. Physical therapists may assess structural problems such as femoroacetabular impingement. Administer topical or oral painkillers only per medical recommendation. Do not conceal detrimental mechanical suffering. In the event of dizziness or lightheadedness, cease exercising, take a seat, and assess hydration medication timing, since some antihypertensive medications may cause dizziness and respiration. Dietary restorative and lifestyle assistance exercise is most effective when accompanied by an appropriate diet and enough recovery. Examine this evidence-based lunge recommendation for older adults. To preserve muscle mass, target 1.0–1.2 grams of protein per kilogram of body weight daily for healthy older people, and 1.2–1.5 g/day day for those recuperating from sickness or engaged in muscle development. Distribute protein intake 20–30 grams each meal to optimize muscle protein synthesis. Prevent chronic undereating by ensuring enough caloric intake. Adequate caloric intake facilitates healing and adaptation. Preserve protein intake and engage in physical training while striving for minimum weight loss. Maintain hydration before, during, and after sessions. Dehydration impairs equilibrium and performance. Sleep. Aim for 7 to 9 hours of restorative sleep each night to facilitate healing, hormonal equilibrium, and cognitive function. Anti-inflammatory strategies. Mild exercise, enough sleep, and a diet abundant in vegetables, fruits, lean proteins, healthy fats, and whole grains help regulate chronic low-grade inflammation linked to aging. Consult a physician on omega-3 fatty acids and vitamin D before self-prescribing. Gentle movement, stretching, mobility exercises, and massage or thermal treatments may alleviate stiffness and expedite recovery on non-training days. Social and psychological benefits. Besides physical mechanics and physiological alterations, the lunge offers other often neglected benefits. Restoring strength, balance, and mobility enhances confidence and reduces fall-related worry. This psychological metamorphosis may result in increased socialization, travel, and engagement in active pastimes. The physical effects are exacerbated by significant improvements in quality of life. Regular practice enhances sleep, mood, and stress management protocols. Maintaining lunges as enjoyable and sustainable, prolonged advantages arise from compliance. Strategies for enhancing sustainability in lunges encompass: perform lunges subsequent to dental hygiene during television advertisement intervals or after a brief walk. Social support, engage in exercise with a partner or inside a supervised class for accountability and enjoyment. To mitigate monotony and tissue strain, diversify lunge variations and auxiliary movements. Establish minor, measurable objectives. Concentrate on advancements such as reduced reliance on supports, more repetitions with superior technique, or expedited functional assessments. Monitor advancement. Document sets, repetitions, perceived exertion, and daily task pain or ease. Environmental indicators. Establish a designated practice place, provide a comfortable surface, and attire oneself suitably. To maintain motivation, recognize little improvements, such as one extra repetition with proper form, more consistent pacing, or less breathlessness when climbing stairs. Addressing prevalent inquiries and misconceptions. Myth: lunges cause injuries to aged knees. Lunges are joint-friendly and may mitigate dysfunction by improving muscular support and alignment when executed correctly. Clinicians may counsel patients with specific joint pathologies. Myth: exercise requires a gym. Fact: the majority of lunge progressions can be performed at home with bodyweight A-chair or common household items for little resistance. Myth: strength training in older adults increases the chance of injury. Resistance exercise enhances strength coordination and bone density, hence decreasing the chance of injury. Oversight and meticulous progression guarantee safety and effectiveness. Synopsis and pragmatic recommendations. In conclusion, aging adversely affects muscle mass, balance, mobility, and metabolic health. Nevertheless, these effects are not irreversible. Consistent execution of a proper lunge effectively addresses these concerns. It combats sarcopenia and reinstates functional strength by fortifying muscles used in regular activities, enhances proprioception, and reduces fall risk by stimulating and honing neuromuscular pathways. It engages neglected gluteal muscles and enhances hip flexor mobility to restore joint range and efficiency. It enhances metabolic activity, insulin sensitivity, and energy levels by activating large muscle groups. This exercise regimen does not need expensive gym subscriptions or specialized equipment. It may start today in a living room next to a kitchen counter or in a garage corner, conducted meticulously with precision and gradual progression. Engaging in a limited number of deliberate repetitions each day signifies a dedication to strength, balance, and autonomy. Each lunge represents a little but cumulative advancement towards a future characterized by capability assurance and enduring engagement. Commence with a 3-minute warm-up, with marching and leg swings, followed by 2 sets of 5 aided static lunges per leg. Incorporate 2 sets of glute bridges and single leg stands, maintaining each position for 15 to 30 seconds, and conclude with light hip flexor mobility exercises. Assess your mood bi-weekly and gradually add repetitions range and light resistance. Incorporate a deliberate diet rich in protein and hydration, enough sleep and gentle recuperation into this training regimen. Incremental, consistent actions will create strength, stability, and autonomy. Thank you for watching the video. Please let us know your thoughts, and goodbye for now.